Just like cardiologists like pictures, patients like pictures. I think that patients derive a greater sense of confidence when they know that you've looked at their arteries or they've looked at their arteries rather than just a bunch of squiggly lines on a treadmill test. Whenever we made a case to our administration, there are two cases to be made. One is the business case and one is the strategic case. The business case became easier because commercial insurance and Medicare were now reimbursing it.
When we look at measures of success for any new technology, we look at validation, and that was evident very early on after implementation. For other administrators considering this technology, the reality is there's no capital expenditure. When we think of introducing new technologies, that's not usually the case. We're usually considering buying wires and valves and stents, and the reality is this is just leveraging connectivity to move forward with a brand new technology in your facility.
HeartFlow gave us the training that we needed both as technologists and administrators to get the program up and running in a very short time. HeartFlow's worked with us to increase our quality, not just for the HeartFlow studies, but all of our cardiac studies.
Once administration said, you know, this is something that we should explore, we realized that it was going to be very hard to do this without a coalition of the willing, and in this case, radiology.
When would you think the day would have come when cardiologists and radiologists would be sitting at the same table? The collaboration and the trust between our reads and the management has significantly improved since the advent of HeartFlow.
Everything about the technology has been exciting. It's been so engaging for the cardiologist. And we've seen the entire spectrum of cardiology service engage, whether they were nuclear providers, whether they specialized in echo reading. They've been really excited about both the turnaround time in getting the data, being able to disseminate the results back to the patient, and the clinical accuracy has been fantastic.
Well, I've actually been asked about HeartFlow by many of my peers throughout the country, and what I tell them is it's a great program, it's easy to implement, the physicians want it, and the patients love the fact that it often saves them additional testing and invasive procedures.
Once I detect 30% stenosis on the images, I send the images to HeartFlow for analysis. 3 to 4 hours later, I get a nice little buzz on my phone, or like a ding, and I could access HeartFlow analysis anywhere in the hospital.
When HeartFlow came in, it was very easy. There was really no difference in our workflow. It actually improved it.
This is an actual picture of my heart?
I think for the patient, the HeartFlow analysis gives them greater confidence in the diagnostic accuracy of the test.
With any new technology, and as doctors we're all skeptical, but learn for yourself, and I think they will be convinced that HeartFlow analysis and FRCT is the way to go in the future.